Welcome to the Laser Therapy Institute weekly podcast, the world's first podcast about medical laser therapy for healthcare providers. Each week, we discuss the latest research, interviews with experts, and how laser therapy can enhance your practice. Now, here is the founder of LTI and your host, Dr. Jason Rountree.
Hello and welcome to the Laser Therapy Institute weekly podcast. I am Dr. Jason Rountree and I'll be your host today. And we are going to be talking about laser basics, laser therapy basics, and safety. You know, we spend a lot of this podcast really discussing some of the real scientific intricacies of laser and what the different conditions are that it can apply to. We haven't really yet gotten into what we mean when we say laser. And this is an important thing to go over because you're going to need to be able to explain to your patients what laser is and how it works, which means you need a good understanding of that from that practitioner standpoint too. And this may already be information you know, but we're going to simplify it a little bit in a way that hopefully you can give this information to your patients in an easy to digest form and also answer some of the questions that you're probably going to be getting. No matter what perspective you look at this, laser therapy has gotten more and more popular over the last few years, more and more widespread. There are more companies out there providing lasers that are for therapy, as well as other light and phototherapy devices. So as those devices become more and more popular and more easily accessed by your patients and those in their family and friend circles, you're going to probably encounter questions from patients who want to know, what is a soft laser? What is laser surgery? What's the difference between what you do in laser surgery? You know, what about LEDs or red light therapy and so many other things that are becoming more popular. And if you aren't really engaged in some of the current happenings or into the research, I will give you that shortcut answer right now so that you can relate some good information to your patients. So first of all, when we say laser therapy, what we're really referring to is what's termed photobiomodulation, right? The use of light to modulate the way the body's biology works. Now, laser therapy was some of the first photobiomodulation, but really we are referring to all types of light therapy. Any type of light that can influence the way the body's biology works in a positive sense, right? Now, that can be lasers, that can be broad spectrum lighting, that can be LEDs. It's an all-encompassing term. Laser Therapy Institute is focused on Class 4 high-power laser therapy. So let's go through and kind of discuss what these different terms and everything mean. So Class 3 lasers are 0.5 watts or lower. So 500 milliwatts or less. Everything that is over 0.5 watts, so anything that produces more than that half a watt, is going to be a Class 4 laser. So your surgical lasers, your lasers that can shoot down drones used by the military, and your Class 4 therapy lasers are all in the same category. So it's a big category. It'd be nice if we had a little bit better breakdown, actually, of it. But unfortunately, we have to deal with Class 4 lasers being in the same category as cutting and surgical lasers. So do understand that Class 4 lasers can mean a whole host of things, but your patients may look at Class 4 laser as being potentially dangerous. And so you'll want to make sure you know enough about this field and about the classifications to be able to reassure them that what you're doing is not a destructive process in the tissues. It's photobiomodulation, not photoablative, where you're using light to destroy tissues. And if you can explain that well, your patients will feel much more confident in getting laser therapy done. So Class 4 laser therapy is simply a more powerful type of soft laser or cold laser type therapy. Now, the biggest difference is that it does not take as much time to deliver a therapeutic dose with a Class 4 laser as it does with a Class 3 laser. And like I said, cold laser or soft laser, those are older terms that refer to the lower powered lasers. with the point being that it wasn't going to be a hot laser or an ablative laser. So when the patient says, "Oh, I don't know if I want that laser therapy. I've heard it's going to hurt my muscles, or it's gonna burn me." Of course, we're not concerned with burns on properly delivered class 4 laser therapy. So one way that I like to explain this to patients is to say, look, the most heat that the laser generates is felt at the skin surface. It doesn't get magnified as you go deeper into the tissues. This isn't a microwave. This is light. You'll feel most of the warmth on the skin, and it's totally safe. Matter of fact, most people don't ever feel hardly anything more than a very light warmth. Some patients do get more heat than others. But as long as your techs and yourself, as long as you've got good training and you understand how to manage the lower levels of warmth and things, you're really going to not run into any levels of discomfort at all. So no worries there. And if you can explain it that way to patients, they tend to get it. They tend to understand that, oh, okay, so I'll be able to tell if it's really warm. And then you start doing the treatments and they go, oh, yeah, this is totally great. And it feels good. It's nice to have that kind of little bit of warmth. It actually feels pretty comfortable to patients. They can tell it's doing something. One of the things that I've seen with class 3 lasers, as a former class 3 laser user, is you do the treatment and patients don't feel anything, and it's almost really hard to get them to mentally be able to understand what's going on, especially as they sit there for 30 minutes having a knee treatment, and when you can deliver the same treatment in less than 5 minutes with a class 4 laser. It all clicks better with the patient's mindset. That's not to say that you can't do some excellent care with a class 3 device. You really can deliver some excellent treatments. It's just going to take longer, and typically it's not as easy for patients to kind of get it. And, by the time they're doing their 8th or 9th treatment with a 30 to 45 minute length of time each time, it gets a little bit tiresome. So a lot easier if you can cram that same treatment into about 5 minutes with that class 4 laser. Now, LEDs. LEDs are being bigger and bigger on the market now because they're getting cheaper and easier to manufacture. LEDs, light emitting diodes, are not the same as lasers. They can still give you some very good red and infrared wavelengths, but they do not have the same penetration capability as laser. And I might get a little heat for saying that, because penetration of the tissues is based on the wavelength or the color of the light. But look, every time that we've compared LED to laser comes out on top. And that may be because lasers are collimated. So you have light that's all traveling in the same direction, and it's located into one area. You just get less reflection off the skin. So you're getting more light into that deeper tissue level with that therapeutic dose. You can get very bright LEDs that can work very well. And I'm not saying that LEDs are not worthwhile. As a matter of fact, in wound healing, LEDs are excellent because you're exposing a greater area of the surface, a greater area of that wound to light. And you don't need to get that depth of penetration. But just realize the LEDs and lasers are not the same. It is different. A lot of the rules are the same as far as the way tissues respond. When you start talking about depth of tissues and even the time it takes to deliver a treatment, class 4 laser generally is going to come out on top. Now, if you want to email me and give me some additional data on what I just said there, or you want some additional information from how I form that opinion, please do. info@lasertherapyinstitute.org. I love talking about laser, and I'd be happy to chat with you about the specifics when it comes to LEDs versus class 3 versus class 4. But I want to move on from that, okay? That should be enough to kind of give you a basis for why we like class 4 laser in a clinical setting, and how it kind of helps to move ahead the patient's care. Now, what about safety concerns? Well, we already talked about warmth, right? And the potential to deliver some level of heat along with a class 4 laser therapy treatment. So can you burn a patient? Well, you can. If you're completely untrained and negligent and you hold the patient down while they scream and say that hurts and you're burning me, yes, I suppose you could. But that is almost to a level of being ridiculous. So very, very difficult to ever deliver any kind of burn with a class 4 laser if you've had any level of training. And if you're not sure about that, or you're not sure that you've had enough training, or you want to ensure that you're doing this safely, again, get a hold of me. We'll help walk you through the basic safety procedures, okay? As a matter of fact, in the very near future, LTI is launching a basic laser safety course with treatment basics included for you and your techs, and you're going to be able to access that at a very, very reasonable price. It's going to be a great course. So if you're listening to this and realizing, I better get some additional training, keep checking on our website. In the near future, that will be live. You'll be able to sign up. It's an online course. You'll be able to whip right through it and have better understanding, better feel for laser in your clinic, and your techs can take the course as well. Okay, but in considerations of safety, get the training, make sure you're safe, but look at your environment too. You need to make sure that you've got the right level of eye protection when you're doing laser therapy. Your device should come with laser glasses. There's additional aftermarket laser eye protection you can get, but you also need to operate the laser within a room, not just out in a treatment floor, because you have a distance around an active laser where everyone has to either wear glasses or not be there. That's called the 21-foot rule. Basically, with anyone within 21 feet of an active laser has to have glasses on. So this is best used in a smaller, closed-in treatment room that doesn't have any windows, or that has windows with coverings. Okay? So you've got your treatment room. You want to make sure that you've got windows covered. Reflective surfaces should be removed. Mirrors and pieces of glass. Even a really clean whiteboard can be a reflective surface. And if you don't have to worry about reflective surfaces, then you have much less chance of having any kind of reflective danger. Really, the only danger with class 4 laser is to the eye, so making sure that nobody's viewing the laser directly, if you just think about that perspective, you'll be able to cover 90% of what you need to. Now, what I'm telling you right now is no replacement for actual laser safety training. I'm just trying to give you a heads up on what you're going to need to plan for if you're thinking about adding class 4 laser to your clinic. Again, check out our laser safety course if you're going to be doing that. We'll make sure we walk you through all the hazards, all the planning, so you do this right. Now, this can be a great service. It really can. You need to be able to explain it to a patient. You need to be able to differentiate how class 4 laser is different from class 3 laser. Be able to answer those questions for patients come in concerned about what they're getting in your clinic or what you're recommending. And the differences, and they find a $10 LED light or laser pointer on eBay or something like that. It's not the same. Why isn't it the same? Well, here's why. You need to be able to explain that. You need to make sure yourself and your techs are safety certified with laser therapy. And you need to make sure you've got the environment and the containment correct. You've got to make sure that your eye protection is up to par. And there's some additional details you need to go over there. Again, let us help you through that. I think what we've got coming out very, very soon for safety training will be excellent. It's quick to get through, easy to understand, and can be used for the whole staff. In the meantime, if you have questions, email me, info@lasertherapyinstitute.org. I'd be happy to help you sort anything out. And I greatly encourage you to get laser in your clinic if you haven't yet. Let me know how we can help.
Subscribe now to keep learning about the growing field of laser therapy. Check out our patient-focused podcast, Healing at the Speed of Light, a great resource for your patients. For massive practice growth and improved patient outcomes, become a certified Laser Therapy Institute clinic. Learn how at lasertherapyinstitute.org.